Okay, thank you. Thank you, Tom and Jeff, for your patience. Members, we're going to be having a presentation before us by the ATCC, the Alcohol, Tobacco, and Cannabis Commission, and we have the Executive Director, Jeff Kelly, Tom Akris, who is the Chief Strategy Officer, and then Andrew Garris. Is Andrew with you today? There he is, Director of Finance Administration and Accountability. So, please.
Okay. Good afternoon, everybody. Madam Chair, members of the committee. I am Jeff Kelly. I have the absolute honor and pleasure of being the Executive Director of the Alcohol, Tobacco, and Cannabis Commission, one of, if not the very best jobs in the state. And I'm happy to say that we've been this independent commission created by the General Assembly for just over 5 years now, this month. So it's hard to believe it's been that long that we've been our own standalone agency. We have a slide. Are we going to be going off of any slides, or are we just going to be referring to the handouts, which is fine? Just the handouts? Okay. So then I'm on the second handout, and just very quickly about what the ATCC is and who we are. We're kind of two components in one. One of them is a group of commissioners. They are advisory people who report to the governor, and they generate some studies. They evaluate best practices. And in a way, they're advisory to us. So if you think of an organizational chart with the governor at the top, there's a line between he and those seven commissioners. And those 7 commissioners are comprised of 2 ex officios. One is the superintendent of the state police or designee, and the second is the secretary of Department of Health or designee. And of the other 5, they're all appointed by the governor. 2 of them are required to have some sort of financial background. One of them has a background in health. One of them has a background in law enforcement. And one has a background in alcohol. And significantly, that person must not be currently employed in the alcohol industry, but just have some background. All of our commissioner positions are staffed and filled, and we meet once a month. Secondly, as part of the ATCC is the Office of the Executive Director. That office is responsible for the day-to-day operation of the agency. That position also reports directly to the governor. So as I was mentioning, you have the governor, you have 2 lines coming off, one to the commissioners, one to the OED, Office of the Executive Director, and there's a dotted line between the commissioners and us. So we communicate back and forth, and we provide staff support for the commissioners as well. And of course, our job changed a little bit a couple of years ago with the Cannabis Reform Act, in that we started to, in addition to alcohol and tobacco, we started providing certain enforcement functions in support of the Maryland Cannabis Administration, and I guess even more so in support of the legitimate adult use business in Maryland. We can go to that next page. Quickly, the ATCC is divided into 4 divisions. The one division is the Legal and Legislative Division, which is, the director is Tom Akris, and Tom will introduce himself, tell you a bit about that later. Another is our Finance, Administration, and Accountability, which is HR, budget, procurement, finance, and also we said accountability. Andrew directs that, and he'll talk about that in just a moment. But we're trying to hold ourselves accountable. We're trying to hold ourselves accountable to what the governor has asked us to do and what we say we're going to do and what you as the General Assembly have dictated that we do. Andrew calls us out when we're not doing it right. Hopefully he lets us know when we are doing it right, but he definitely calls us out when we're not and lets us know that. 2 other divisions are the Field Enforcement Division. That's our largest. That's about half of our crew. Our entire agency is 61 people strong. About 30 of them are sworn police officers as part of field enforcement. Almost all of them have retired from some other full-service police department in Maryland. They're mature, responsible people. They know how to use their words to disentangle from situations that could be a little sticky. They're very good at that. And while they have a commission from the Training Commission, they could leave us tomorrow and go work for any other police agency and be fully authorized to do so. Our legislation here, our jurisdiction here, while statewide, is legislatively limited to topics. And those topics are alcohol, tobacco, some elements of cannabis, and some elements of the business regulations. And then our last division is the Licensing, Research, and Trade Practices, and that's the reason the rest of us all exist. They're the ones who interact with the industry. They license the industry, they provide training for the industry, they conduct research and studies and publish reports for the General Assembly and for other functions. Next one is just a quick overview of our work regarding tobacco. We license the tobacco manufacturers, and we license wholesalers in Maryland, tobacco wholesalers. And that could be cigarette manufacturers or wholesalers, OTP, which if you're not familiar with OTP, it stands for other tobacco products, which is a real term actually in statute. And it means pretty much if it's not a cigarette, which is very narrowly defined, and if it's not an electronic smoking device specifically, everything else is OTP. It's all lumped in one category of OTP. And you can make the argument that electronic smoking devices are a subset of that. They probably are, but they do have a separate area of law that addresses them specifically. So as part of the ATCC, we enforce the laws surrounding tobacco. What's really interesting, and I've been involved in this now, I've been with the state for 23 years, and at 18 years I've been in this role as a director of some sort. And what's really interesting is watching the migration from being a state where we'd watch people bring cigarettes into Maryland from Virginia because Virginia was charging at the time 3 cents per pack tax when Maryland was charging 60 cents. And they could make some money. But about 25% of the cigarettes that were coming in from other states were coming into Maryland. The rest were going north to New York, New Jersey, Michigan, where the tax rates were much higher. So they were passing through. Today, our tax rate is $5 a pack. That's the second highest tax rate in the nation, of any jurisdiction in the nation. We are no longer a pseudo-target state or a pass-through state. We are the target state. And what makes us so attractive is Virginia still has a relatively low rate, and North Carolina has a very low tax rate per pack. Those two states are big manufacturing states. And North Carolina makes themselves even more enticing because they don't require a stamp. They're the only state in the country that doesn't require a tobacco stamp on a pack of cigarettes. That tobacco stamp for us is the quick indicator that taxes have been paid. But our taxes now at $5 have caused another problem that we haven't had before, at least not in any significant amount, and that's counterfeit stamps. We just went to a new stamp a few months ago with a crab on it. And every few years, generally when a tax rate changes, the stamp changes. It didn't take any time at all for those stamps to be counterfeited. And so now what we're seeing are operations, significant operations in Maryland, going to North Carolina, buying a lot of cigarettes that are not stamped, and literally in their houses or in buildings have ironing boards and irons and pages of fake stamps that they're ironing on there. And I say that, I know that, because over the course of the last year and a half or so, we've done 2 search warrants on operations that were generating somewhere around $100,000 a day in diversion taxes. Money they were keeping that would have otherwise gone to become taxes in Maryland. We know that's happening. So it's a really big deal, and a lot of our attention shifts to that. Also, other tobacco products come in from Pennsylvania, largely, because Pennsylvania, when it's a product to be shipped out of the state, charges no excise tax, but Maryland's are fairly high. Maryland's excise taxes on the low end are 15% for premium cigars and pipe tobacco. It's not bad. For most other tobacco products, they fall in the 53% range, which is getting to be pretty high. And then for the mass-produced cigars, White Owl, and I'm not trying to say some are better than others, but if they're not premium, and you might have a sense of what's premium, the other cigars that are produced are 70% the tax. So you might go to a store, you might go to a wholesaler, a retailer would, and buy a cigar for $1. It's going to cost them $1.70. Or they can buy it from Little White Van. It just came down from Pennsylvania and buy it for $1.10 or $1.20 and save a lot of money in the taxes. We see a lot of that. So we spend a lot of time inspecting these locations, and I'll just tell you, there's probably about 6,500 or so tobacco outlets, retailers throughout the state. We do about 40% of them every year. We have the goal of trying to get through them all every couple of years. We go to problem places more often than that. But we have a crew that specializes in these lengthy investigations that I was mentioning about in North Carolina. But it's a big issue. If you get the opportunity during the interim, perhaps, I welcome you to come up and visit us in our headquarters in Baltimore. The beauty of it is it's about 1 traffic light into the city, so it's easy to get to. You get the city feel, but it's very, very easy to commute to. And I think you'd be impressed when you see our storage room and the quantity of product that comes in, and we are constantly, after the cases are adjudicated and the appeals period is over, destroying it burning this stuff, but it keeps filling back up because there's just so much of it. I invite you to come up and see that. Of course, we absolutely work with local police departments. We are actually an interesting tool for them sometimes because we can get in and do an inspection where they might have difficulty getting in. We really know what we're looking for. We'll flip to this next slide, which says alcohol and tobacco licenses. Just very briefly, pay no attention to the alcohol license. You don't have to worry about that now. But on the tobacco side, we issue just a little over 260 licenses regarding manufacturers and wholesalers of the various different types. Flip to the next page. It says Master Settlement Agreement. I don't know how many of you are familiar with that, but very briefly, that is an agreement between what they call participating manufacturers. These are cigarette manufacturers who've agreed to be part of this Master Settlement Agreement between those organizations and many states, but Maryland is certainly one of them. That essentially says for these manufacturers who've agreed, they give Maryland a certain amount of money each year, and it's anywhere from $100 million to $150, $170 million a year based on a variety of factors. And they give it to us because I don't want to say they're acknowledging anything. They give it to us to offset some of our costs of providing health care for people who've used or abused tobacco over many years. Part of the stipulation is that we have an obligation of being very diligent in our enforcement of a variety of tobacco regulations and laws. And if we're not, they will sue us. I can tell you that they have sued us for every year that this Master Settlement Agreement has been into effect, which may have been 2002 or 3, I think, in the early days. But we've been sued every year since then. The burden of that falls on the Attorney General's office. He has a tobacco enforcement crew that does that work. But we and auditors from the Comptroller's office are the foot soldiers that are out inspecting places, making sure that the product that's out there is what's compliant and authorized under the Master Settlement Agreement. And last, the fire safe certifications. Several years ago, many years ago, the General Assembly wisely, because I think every state does it now, but we were not the last, we were in the middle of that, wisely requires that cigarettes are fire safe, which simply means if someone isn't actively smoking on them and drawing into them, they self-extinguish. So it just minimizes the opportunity for there to be a fire, an accidental fire, perhaps from somebody who's been smoking and falls asleep and that lit cigarette ignites something. And I'm going to turn this over to Tom in just a second. We're going to talk about how we handle administrative violations of cigarettes. And Tom is not one, he's an attorney, but beyond that, he's also our prosecutor, our lead prosecutor for the agency in presenting our cases when we find violations. And I'll just tell you very quickly how that happens. The local jurisdictions do certain investigations. Again, Tom will explain this more in detail. But when they do, they charge a person who sold, as an example, to an underage consumer. The person who sold, not the business. That person made the sale. That becomes adjudicated in some fashion, whether it's through courts or in some other local mechanism. If that happens within a certain time period, then they'll refer that case to us, and our action isn't against that person any longer. It's actually against the license itself. Is that business being conducted in a way that's fostering sales to underage consumers, or are they trying hard to avoid that? So, Tom, would you take it off on that?
For the record, Tom Akris, Director of the Legal and Legislative Division with the Alcohol, Tobacco, Cannabis Commission. So talking about administrative hearings specifically for tobacco licenses, we're going to look at underage prosecutions because that's really where the bulk of our referrals come from. And so we work with local health departments who have cadets that they contract with to go in and make these purchases. There's also something called SINAR checks. This is associated with federal monies that come to the state of Maryland. The health department contracts out with contractors to go into stores. So we get all of our referrals through either SINAR checks and our local health department checks. If there are 2 violations within a 12-month time period, then those can be referred to our agency and we'll prosecute those within about 60 days. This is actually, you've seen a little bit of a ramp up of this due to something that the Maryland General Assembly passed a couple of years ago. Maryland General Assembly passed the Tobacco Retail Modernization Act in 2024. And what that did is it did a couple things. First, it raised the fees for these licenses. They used to be $25 for a cigarette license, $25 for an ESD license. It's now $300. With the monies that came from that revenue, those revenues were to go to the local health departments so that they could conduct at least 1 inspection a year. So that's the baseline that they're to conduct. If there's a violation, an underage sale, then they have to go back within that next year to conduct another inspection. In addition, the Tobacco Modernization Act also disallowed kiosk sales of tobacco products. So all transactions for tobacco products have to be face-to-face. So using this law, we've seen a big ramp up in the cases that we get. And you can see that here in the graph. Dating back to 2022, you'll see there were 12 referrals made to our agency that we actually, that we prosecuted. Now we're up to this past fiscal year 70, and we're going to increase on over that. And that's because of the outreach that we do with the Legal Resource Center, the University of Maryland, and local health departments. We're attending forums, we're doing outreach because we want those referrals. And if I may, this won't be the last PSA. If you are having issues within your jurisdictions regarding this access, we try to be proactive. You can make those connections with those health departments. We would love that opportunity to work with them to educate, to get more of these referrals to our agency. And I guess the pathway that I told you about for underage sales is the pathway for any violation really against a tobacco retailer. If there are any violations that we get from the locals to include underage tobacco sales, we will take it in the same way. Jeff, you want to go to the next slide?
Absolutely. Okay, so we're on this red color slide, says THC and Maryland preview. I'll start off by saying, and I don't say this lightly, kudos Maryland General Assembly. The Cannabis Reform Act that passed a few years ago is stellar. It is one that states today who are considering legalizing cannabis go back and refer to see how you do it. We learned from all of these states that did it before us, Washington State, Oregon, Colorado, we learned from all of their mistakes. And you guys put together a package that was so well, so strongly encompassed, and Andrew can attest to that because Andrew came from the Maryland Cannabis Administration, that it works. It really works. We had some struggles with elements of it, not because of the law, but because of judicial determinations early on from a variety of complainants, largely being those in the hemp industry. So what you did was the THC business in Maryland, you created a three-legged stool. One of those legs is the Maryland Cannabis Administration. They're responsible for the legitimate business. They license the businesses. They regulate the businesses. They don't have any law enforcement power there. If they had a law enforcement issue within that, they'd come to us and ask us to help them out. But they take care of the legitimate business. You created the second stool and actually just maintained the second stool, which used to be the only leg to that stool. That's the illegal street-level dealing of marijuana, pot, weed, whatever it would be, that still exists, and that enforcement responsibility still remains with local police departments. But then you created a third leg to this stool, and that third leg is this illicit market. You did that by identifying THC as the psychoactive component that you cared about and you wanted to have regulated. And by doing that, you said, we don't care if THC comes from marijuana, which is where we hope it's coming from, or if it comes from hemp, or if it comes from some synthetic mechanism. We don't really care. What we do care about is the quantity that's allowed in each serving and in each package. And when you did that, you didn't create this bucket, but it found its way, like it does. An industry found a way to try and slip in the middle of this, that they could still exist. Largely, it was based on hemp people. And they simply said, well, it's federally legal, and they convinced shop owners across the state that hemp is different than marijuana and really doesn't apply to this. And besides, the federal government says hemp is okay, which they've changed their minds on maybe soon. And maybe Tom will expand on that for us in just a minute. But in doing that, you said we don't care how you get your THC, we care about the quantity. So our role is the illicit market where THC is sold. Looks like it's properly packaged. It looks like it's a legit product. It looks like it looks similar to, in many ways, it looks to what you might find at a cannabis administration dispensary who is licensed. It's not. And you'll find that probably in thousands of stores across Maryland. These are stores that sell other legitimate items. They're convenience stores. There's stores that are at gas stations. They're all over the state. But you're going to find that that's the third leg that you created that we enforce. And I suspect many of you, as we have been hearing over the years, I suspect many of you have been hearing from your constituent businesses that are in the legitimate cannabis industry. Nothing's happening. Nothing's being done. This bill's been in place for a couple of years, and nobody's doing anything. And Tom reminded me of a song from back in my youth. So maybe you won't make any reference here, but it was from a group called Sam and Dave, and the song is "Hold On, Here I Come." It's "Hold On, Here We Come." When you guys passed the Cannabis Administration Act, and I'm going a little out of order on the slides, and we'll skip over this when we get to that slide again, but just to give you some history, when the Cannabis Reform Act became law, which was July 1, 2023, we went out, as we always do, and those of you who know us for years know our goal is to educate and inform the public and the businesses, not to go out and clobber them, but to help them comply. We went out for that first month and a half. The goal was to spend much of that summer educating all the people who were selling this product, saying, hey, it's illegal now. Here's a brochure. Here's where you can go for more information. Look it up. Don't sell this stuff. We'll be back. We'll be back. Well, before we ever got back, the Maryland Hemp Coalition went to Washington County Circuit Court and got an injunction against us. And the judge ruled in their favor and said, ATCC, sorry. If these businesses were operating in an otherwise legitimate manner prior to July 1, 2023, you may not take any enforcement action against them for cannabis. So we were handcuffed because that included everybody except someone who maybe opened up in the last month or two. Little by little, some businesses tried to open up after that period of time, but since that time, for a period of almost 2 years, we were handcuffed. We made very few cases, maybe as many or as few as 18 cases. We didn't even seize. We would go into a shop and we would buy something undercover, one pack undercover, and send it off to a lab to be tested. That took about 2 months. By the time all of that was wrapped up, it was about 3 months from the day we went into the store to the day we were able to go back and charge somebody for making the sale. And all we did was take one product off the shelf, and all the rest of it stayed on the shelves for 3 months and then some. So we had hundreds of dollars worth of product that we bought and had in our evidence room. That was all leading up to, well, while this injunction was on, which just ended like back in October, this most recent October. So last year we came to the General Assembly and we said we need some help. And House Bill 12 was introduced. And the help was we need to do a better job of identifying bad product. We think if we go after the labeling, we're going to say to people essentially truth in labeling. If you label it as a product that you say there's THC in your container and you say it's 600 milligrams per serving, we believe you. That's enough. You say that, that's in violation of Maryland law, because if you're going to label it as THC, you have to come in compliance with what the Cannabis Administration says labels must have on it. So we believe you. That was part one. The other part was, if you advertise this product to children, it is on its face illegal. When we say advertise to children, you'd see cartoon characters. You would see it in products. Yeah, next page, I apologize. This says cannabis sales, and it's got on the left-hand side, that's some little colors there. It would say Captain Crunch, Oreos, Starbursts, tastes like gelato, all these different flavors. So it'll be flavored products, clearly geared towards children, bright colors. We ask that it not be labeled that way. It can't be labeled towards the children. You guys granted us that piece of help. You did other things in House Bill 12 as well. You let us charge for the Delta products, which when I say charge, I mean like write a citation for violation of selling synthetic or Delta 8, Delta 10 type products. But what you did for us, we're going to go to this page here. What you did was took our timeline of going into a place, buying one item, sending it off as evidence to be tested, waiting for 2 to 3 months to charge an individual for that while all the other products stayed on the shelf. You allowed us now to go into a business, to look at all the product, and there are shelves and shelves full of product, to look at it all and see if it's advertising towards kids or if it's labeled in some way saying it's got THC in it, and then compare that to the new law. And if it was in violation, we were able to seize all of that product immediately that day, charge somebody by citation that day, and then go to court proceedings. That was it. Just to give you and that went into effect July 1, 2025, just to give you a sense of how effective that was. I mentioned we probably took hundreds of dollars worth of evidence from July 1, 2023 to June 30, 2025. Starting July 1, 2025 to today, we've seized over $2.25 million worth of this product. There's a lot of it out there. And we can go in now because you gave us the authority to identify the labeling and the advertising in such a way that was in violation. It's been highly effective. So we were saying to your constituents, hold on, here we come. We're making a difference. We meet regularly with the industries, and we've been sharing with them this information. I'm going to turn this over to Tom so he can talk about some of the legal aspects of what happened with House Bill 12, what you gave us with House Bill 12, and how some of that's worked out. So we'll be shifting back and forth a bit. But Tom, would you go ahead and expound?
Not a problem. So what you have here are the two critical charges that our officers use when they're charging these THC cases. And thankfully, through House Bill 12, what you did was solve our mens rea problem. Now, what does that mean? As a former prosecutor, you have to charge both intent, you have to prove both intent and an act whenever there's a criminal act. What you did with the Cannabis Reform Act is when you said advertising, offering for sale a product that is mislabeled is automatically a violation of the law. So when our agents go in and they see deli jars full of flower product, which if you were ever to walk into a legal cannabis store, that would never be how they would be packaged. They can't be in jelly jars. When you see products that advertise 1,000, 2,000, 3,000 milligrams, right away you're advertising a product and our officers can take it right off the shelf. These have been the most effective charges because they don't require a chemical analysis. And this was a big piece because a lot of judges and a lot of prosecutors looked at these cases like narcotics cases. And we really had to do a shift away from narcotics cases because we didn't need a chemist. We didn't need a lab analysis. We didn't need all the things that you need if you were proving a narcotics case. So that's been a big shift for us, and these are the two main charges. It's the labeling, and it's advertising a product that has labeling that's not in compliance with the MCA. So that was a very, very big deal for us. And I will say that the courts have really turned the corner and given us some finality with the strength of Maryland's law. And by that I mean, back when, and Director Kelly was talking about this earlier, when the Cannabis Reform Act was passed, we were almost immediately sued in October of 2023, and an injunction was imposed on our activity to really go after any of these stores. So our hands were tied. In October of 2025, the Maryland Appellate Court made a determination that the Maryland General Assembly got it right, that the police powers that they afforded to the ATCC were correct, and they were able to do that. And just yesterday, kind of hot off the presses, the Maryland Supreme Court rejected the bid for appeal by the Maryland Hemp Coalition to go to the Supreme Court. And so what happens now is there's an active case in Washington County, which is how all of this started. The Supreme Court will now remand it back to the Washington County Court, who will make a determination, but the state is in an extremely strong position. Can't talk about the specifics of that litigation, but the state will be in an extremely strong position going back to that. So that has empowered us really to act against all parties, whether they were present before July 1st, 2023, or after July 1st, 2023. Go after these folks who are selling this product that has not been approved, that has not been tested, and may have who knows what in it in terms of adulterants.
Okay, thanks. Next two slides, we go very quickly. One, it says Field Enforcement Division, all red. Already talked about them. It's our 30 agents who are sworn police officers. Just to give you a sense on the volume of work I mentioned regarding tobacco, there's about 6,500 outlets in the state. And they also do alcohol inspections. There are about 8,500, give or take, alcohol retail locations that we are involved with each year. We don't do them all. We simply can't. And THC is interesting because we know how many alcohol places are in the state, and we know how many tobacco places are in the state, but since the unlicensed sale of THC is illegal, we haven't got a clue. So we're virtually doing inspections in each of those places, and I'm going to ask Andrew just in a minute or so to weigh in on that. The next slide we will just skip because I kind of already went over it. It's the one that brought us from July 1, 2023, where we couldn't do much, to now, except to say where I mentioned the first 2 years we did about 18 cases, and then in the last 6 months, 6.5 months, we have done well over 100. So it's our ability to actually enforce and do things. It's there now. Before we talk to Andrew about that, yeah, Tom, you want to run on that part?
Yes, ma'am.
Yeah. So this at the top of this one, it says ATCC enforcement on the left, and the first thing is SAO outreach.
Yes, thank you, Jeff. So kind of leading up to this and how we've been affected is I almost look at it like a house. The foundation of the house was the Cannabis Reform Act. And the bricks that we've been layering on top have to do with outreach and House Bill 12 and Senate Bill 214. So after the Cannabis Reform Act was passed, we proactively did outreach to all the state's attorney's offices across the state to let them know about the new law, let them know about our role and how we would be bringing cases before the state's attorney's office. Lo and behold, the injunction hit and our hands were tied. We were still working with the state's attorney's office to do a number of other cases like our tobacco cases and some of our alcohol cases, but we still had the conversation going with cannabis. Once this House Bill 12, Senate Bill 214 passed, we again re-engaged with the state's attorney's offices. We met them at their Maryland State's Attorney Association meeting in the fall to go over this specific law and establish, and this was key for us, points of contact in every state's attorney's office who would receive these cases, because a lot of these cases prior to would go to a docket that was an early resolution docket, and they would be null prossed. And so if these cases get null prossed early on and somebody's not watching out for them, there's never going to be an accountability for that store owner. So we really had to stress the priority that the Maryland General Assembly had when it came to prosecuting these cases. We also do, and we met personally with State's Attorney Bates and Schellenberger. I can go on, but we've been doing a lot of outreach across the state. We also do prosecutor training. We work with the State's Attorneys of Baltimore City recently to do a whole training on exactly how you prosecute these cases, what are the elements you need to prove, what's the evidence you need to prove, how they're not like narcotics cases. I think that's been going very, very well because we're getting requests. I would ask you, here's my other PSA, that if there are state's attorneys in your jurisdictions that are having questions or concerns, please direct them to us. We want to work with them to empower them to prosecute these cases successfully. And we do a lot of public health outreach too as part of our mission as the ATCC. There's a public health component. One piece of this and a good example of this is during the Halloween season, particularly with THC gummies. There was a lot of packaging that we saw that was directly pointed towards children, with Halloween globes and characters dressed in Halloween outfits. And we immediately went on and created, in social media to our eGov delivery system, PSAs that we work with the Maryland Health Department on to push out telling, parents, if they're seeing this stuff, please report to us. If your kids get it, please report it to us. We're here to help. So we do that also, the public health. And you'll see in the next slide over, this is the cannabis enforcement. I think I'm going to do a little bit and then pass it over to.
Yeah, I'll just add this about the outreach because you saw yourself short. Tom also organized us meeting with, and I think we hit almost all of them, almost every senior law enforcement agency in every jurisdiction in the state met with their offices and with government leaders across the state and explained all of this. So we met with, I would say, maybe one state's attorney we didn't meet with. All the rest of them we did. Police agencies, I think we hit all of them. And with the government, I think we hit all of them to let them know what's going on, constantly making them aware and introducing ourselves so they know where to go if they feel like they're banging their head against a wall with some difficulties. But it was a lot more than just state's attorney work, but it was so. Go ahead.
Appreciate that. Thank you.
Yeah.
This next slide, it's the cannabis enforcement slide, and you'll see some of the real hard stats here that we're talking about. There have been approximately 1,200, and this is from July 1st, 2025 to December 31st, 2025, just the first half of the fiscal year. We've done about 1,200 inspections. That's resulted in 111 charges, right? They're going to be different charges versus 99 cases charged, right? Some folks are going to have 2, 3 charges. Others will have 1, 2, et cetera, et cetera. But you'll see there have been 17 docketed. There are now 53 pending. That number is much higher now because we've had about 2 more weeks. And we're looking at, and I really, I could say conservatively, we would say we'd be able to double the amount of cases to 200 by the end of the fiscal year with what we're doing and how proactive that we're being. Did you want Andrew to touch on?
Yeah, I want to start with the statewide enforcement. And Andrew, as I mentioned earlier, more of his reason here is, one, he's got extensive experience through the Maryland Cannabis Administration with the industry itself, and secondly, through his work holding us accountable, he monitors the inspections we're doing, where we are, what numbers we're producing, what some of the effects are we're producing. So please.
Sure. Thank you, Jeff, Tom. So again, Andrew Garrison. So what we have here first is in the first 6 months of the authority that you all gave us under House Bill 12, we've seized an estimated about $2 million worth of product. And if you were to go look today, as Jeff mentioned, that's above 2.25 now once we start looking at what the work we've done thus far in January. And again, you can see here as well, too, a lot of the cases that we are able to make is from those 2 new charges that were added under House Bill 12. The other piece of this is a little bit how our field enforcement division and the operations work there. We've mentioned a few times we have 30 sworn law enforcement officers all throughout the state. We also have a special cannabis unit, right? But those aren't the only folks who are doing these THC types of enforcement. We have regional jurisdictions as well. And oftentimes when our guys are walking into somewhere that is a tobacco licensee or selling OTP products, they are still checking for THC products just to make sure that those aren't on the shelves there either. One of the real I think, insights of the Cannabis Reform Act back in '23 was an understanding that a lot of these unlicensed THC products will be co-located or will be sharing shelves with other tobacco products, with cigarettes, with cigarette retailers. The gas stations, the vape shops, the smoke shops are oftentimes going to be folks who would be interested in carrying these unlicensed products as well. And so really being able to sync our enforcement efforts that way, where we don't have to have a different agency or a different unit of state government really focus on this. It already really nicely dovetails with our existing work. One of the best ways to demonstrate that is during calendar year 25. Our guys walked into about 4,000 stores of various of either alcohol, tobacco licensees throughout the state, and about 70% of the time they were also looking for THC products. So they were, even if it wasn't, a place with a big neon sign that said Delta 8 or THC sold here, we still want to make sure that those folks who are otherwise, again, a perfectly legal business aren't pushing the boundaries of what you all have allowed for the availability of THC products. So that's something that really makes a lot of sense for us, something that we're really proud of the work that our guys have done there.
Yeah, sure.
And then again, the next page, we have a quick map here. This is a breakdown of, again, just really demonstrating that these cases that these inspections and these subsequent cases are really happening all throughout the state. And, it's not, there's obviously a concentration where some population is, concentrated as well. There's more of these stores, but we are all the way out in Western Maryland, all the way on the shore. Again, it is part of our routine inspection piece now to be looking for compliance, or that folks are not pushing the boundaries of what you all have allowed for the availability of THC in the state. On the next page, a few other pieces that I want to highlight here is, first is something that I'm additionally really proud of, and that is our cannabis enforcement dashboard. If you all were to go to our, if you all were to go to our website right now, atcc.maryland.gov. And if you're doing it on mobile, you have to scroll down a little bit. If you're doing it on web, it's kind of off to the right-hand side. You'll see something that says Cannabis Enforcement Dashboard, I believe that the heading is. And what that is going to be is a weekly update of the amount of seizures that we've made on these unlicensed THC products. So we updated on Wednesdays, so it was 2.25 million last week. It's just under 2.3 now. I want to say 2.29 in that neighborhood, a million estimated value. And then how we've divided that up is sometimes we see a loose flower product. So think of if in the traditional cannabis market, right, a pre-rolled joint or just an eighth or something like that, or a package or processed product, a gummy or something like that. We have that divided up as well. And then also if you scroll down a little bit further on that dashboard, we will tell you the total amount of seizures that have happened within a specific jurisdiction. So across all the counties in Baltimore City, we have a total number there, again, giving you number of items seized, estimated value, and then as well as the flower weight as well, and a total estimated value for that. And this is really just the first step for this dashboard. This launched 48 hours ago, I think, for us. And so as we start to hear more feedback from you all, from other stakeholders, we want to be adding more features to this. Again, where I've come from with my background in working on the Cannabis Reform Act and with the Maryland Cannabis Administration, I know how important it is to get this unlicensed THC market under control. We've done studies on these products, the MCA had, and they are oftentimes have far more THC in it than that would be allowed, do not go through the same regulatory testing, do not go through the same labeling pieces. And so we really want to be proactive in sharing our successes of getting some of these products off the streets and out of locations that are not held to the same standards that our colleagues at the MCA are doing. Additionally, two other points that we want to highlight as well, and this is again a resource that we offer to you all, your constituents, your local elected officials, is some additional collaboration with either local police departments. So we've had instances where in Baltimore City, for instance, there will be a location that is, let's say, flirting with the line of a legitimate business versus just a place that's selling like a large amount of marijuana or cannabis club type of thing. And we will be working with Baltimore City PD to, is that something that needs to pursue a more criminal possession, or is it something that goes against us on the business regs thing? Again, we have a certain amount of expertise when it comes to these unlicensed THC cases and products, and so we're really happy to be a resource for local police as well when some of these instances pop up, and then also local jurisdictions as well. So again, in Baltimore City, the council members had expressed interest in a zoning reform potentially for some of these unlicensed smoke shops, right? They were getting a lot of constituent complaints, and we were really happy to work with them to draw a distinction in the law between where they might have authority with local zoning and where that might conflict with what you all have done on the licensed cannabis establishments as well, and making sure that locals are also empowered to do this. As Jeff mentioned, we think there's probably thousands of these licensees or locations that may be selling an unlicensed THC product. We have 30 guys doing it. We can't be everywhere all at once. We're trying, but we really do want to provide local jurisdictions, local elected officials, local police with the tools to help us with these efforts as well. Last thing I want to highlight is we've additionally worked with our colleagues at the Maryland Cannabis Administration as well. They do a lot of public health messaging and outreach. One of their current campaigns is what they're calling their Trusted Source campaign. So you will be able to go to a Maryland licensed dispensary and they'll start to have like a little sticker on the window and a QR code that points you to a map of all the licensed locations in the state that are selling a regulated, tested product through the framework that you all set up. Where we come in is we think that the inverse of that is a sort of an untrusted source, right? Somewhere where maybe you shouldn't be buying cannabis or THC product, right? I know when I talk about what I do for a living with some friends of mine or acquaintances, right? Not everyone knows that. Everyone saw that cannabis reform was on the ballot, right? They probably heard that you all passed something a couple years ago, but they didn't necessarily know, oh, does that mean it's the stuff at the 7-Eleven is now legal, right? It must be, right? I voted for it and here it is. And so what we really want to do is help inform folks that that's not the place to buy cannabis products if you choose to indulge in that. And so part of the ad campaign that the MCA bought and put forward has a tip line for us that goes to our folks to say, if you are seeing a THC product at a gas station, a vape shop or something like that, you can tell us about it and we can go in there and check it out, make sure that they're not selling products that they shouldn't be. And that tip line that we have on the billboard is also something that you all can use and put out to your constituents as well. It's thctips.maryland.gov. Again, that goes right to us. It's a little bit shorter than doing a longer URL on a state website. So that's something we're really excited about as well.
Thanks, Andrew. And so just last comment is, I think that the work we've been able to do under House Bill 12 especially, that you passed for us, has been effective. Because now when we walk into many of these places where there would be shelves of THC, there are not. But what we know is they're keeping them in the back room or under the shelves and under the counters, and we simply have to ask for it, and they'll make the sale still. So that gets us in there. But they're starting to change a little bit the way they're doing their businesses. So happy to take any questions. That's our presentation. And
Thank you so much. Before I take questions, I will say, Jeff, you made a comment earlier about, you said something about alcohol and you said, well, we don't have to worry about it. Well, I have received confirmation today from leadership that we, ECM, will be handling state alcohol legislation.
oh,
So, yes,
interesting.
apparently,
Okay.
and GLEE will be handling local alcohol
Interesting.
legislation. So I
Wow.
thought the members might like to know that piece
That's
of information.
fascinating. Yeah.
I'm sure you're happy, Delegate Ampry.
Yeah. An interest there, maybe.
With that said, I just wanted to make sure
No,
the
thank
ATCC
you
was
for that.
aware.
That's hot off
and
your
that the
press.
members were aware. I had been hearing rumors, and so I got confirmation from the higher-ups this morning. So it was perfect timing to share it here. So with that said, we have a round of questions here. I'll start, and I tried to do the best I could when I saw the lights pop up.
Fantastic.
Delegate Chi.
Thank you, Madam Chair, and thanks for the presentations. It was a lot to unpack. Thanks for your work, first of all. So a couple questions. Jeff, you said earlier in your presentation there was something about the fake stamps. Are you suggesting that because of our tax rate, which is now per pack, we have become inadvertently a target for the counterfeiting stamps and losing to the tune of 100,000 just on a random day, a month, a year. I mean, what are we talking about?
No, I mean, I'm not making that suggestion. I'm really just trying to make a statement of fact that throughout my career, we would get, as I mentioned, about 25% of the people we would stop for importing these products into the state would say they're coming into Maryland and they're going to a particular place or places to sell, and a balance of them are going through the state. We're seeing more now where Maryland is the place to go because we're just closer. It's cheaper. They don't have to drive to New York to sell their ware. They could just drive to Virginia perhaps and then come right into Maryland and make their sales. But about the counterfeit stamps, rarely, I mean, I think I could probably count on one hand how many times I'd seen counterfeit Maryland stamps. It just wasn't worth doing, and there are other places where it's more worth it, where they were charging $3, $4, $5 for the tax. But we're seeing that now. We're seeing those much more readily now than we have before, because I guess it makes financial sense for the criminal element.
Okay, so my question is, are you suggesting because of a higher tax rate, we are encouraging that kind of activities?
I don't even like to use the word encouraging. I'm just, I'm just saying, I think as a matter of fact, because our tax rate is very high in the nation, because it's very high, it's just that we're now a place that some of the criminal element may choose to do business, where in the past it was not as, but I think it was not as prevalent. But I think it's just a function of that's what our tax rate is, so we have to be more on guard. We have to be looking for it. I would say this, the legitimate tax stamps have built in them certain security features, and we're pretty well trained and aware of those security features, and some of those features require simple but additional equipment to do an inspection with, but they're very quick and very easy to do, and we do those. So overwhelmingly what we're seeing on the shelves of businesses are legitimate stamps. But there are some of these operations that are not necessarily legitimate. They're not always on display. When we go in and do the inspection, they might be in a back room, which we don't have authority to go into and look at without warrant. I would say this committee years ago on House Bill 1000, a few years ago, this committee introduced a bill and got it through the House that would have allowed us to go into those back rooms where they store their tobacco product to look for those kinds of things. Sadly, it didn't make it through Senate Finance then, I believe it was, and it stopped. But we don't have the authority to go in other places. But I know in some operations, they'll have those counterfeit cigarette stamps underneath the counter that they'll gladly sell to people they know, regular customers, people they know who aren't likely to complain or check any further.
Okay, I do have a follow-up question unrelated to, well, it's actually also related to tobacco. You mentioned on one of the slides about the master agreement. What's it called?
The Master Settlement Agreement.
Master Settlement Agreement. So I understand that there are about a couple of manufacturers that are slightly smaller in scale that fall out of the Maryland's Master Settlement Agreement, which means they only need to pay into an escrow fund.
Correct.
And they can actually recoup the escrow fund entirely, including interest, right? They are not contributing to whatever the fund you have to treat people with addiction and public health issues, PTSD, whatever. So I was trying to fix that inequity, and the bill didn't pass at the HGO. But I just wonder if you have any concerns about these two kinds of categories of tobacco manufacturers in Maryland.
I don't, and I'd say, and I would go back and say perhaps the Attorney General's Tobacco Enforcement Unit may. I don't. The Attorney General's Tobacco Enforcement Unit's made our work on this easier to do, because if you're a participating manufacturer, you're on a registry, your company's on a registry that says you and all the products you make are authorized in Maryland. If you're non-participating, which are some of these smaller companies, but you pay into an escrow, then you're also on that registry that says you're authorized to sell into the state. So just because I understand they put it in escrow, and I'm really not sure how that financial end of it works. I really don't know. But what our role is the Attorney General's office publishes, through this enforcement unit, publishes regularly a registry of cigarettes that are allowed to be sold in Maryland by brand. And we're at the top of the list, I think, of the recipients of that list. And we get that list, and we conduct our tobacco inspections, and we probably do about, 3,000 or so a year of these inspections. We check to make sure that the cigarettes they're selling, in addition to everything else, tax stamps and invoices show they're coming from Maryland wholesalers. We check to see that those particular brands are authorized on that registry to be sold. And that is a very dynamic registry. It can be changed several times in a month, or it could go, be static for a couple of months because no changes have taken place. But we inspected that registry. That makes our job a little bit easier.
Okay, well, I understand you are not OAG, but thank you. Okay.
Sure. Yeah.
Delegate Aaron's.
Thank you, Madam Chair. Welcome back, I guess. All the way around, huh? Questions are about this master agreement. Where do those dollars go?
Again, I believe they go toward treatment programs for people who have been.
Exclusively, you don't know if they're anywhere else in the budget?
I don't know that they are. I just don't know. Andrew maybe has a sense.
So if I recall correctly, there is, in the budget highlights book, one of the appendices is about the cigarette restitution fund dollars and the distribution of the cigarette restitution fund. I could find it for you. I was in the budget office 4 years ago.
Just curious. The other question I had, have you looked into this tax, this $5 tax? When you talk about the illegal cigarettes and what all's coming across the lines, have you done any kind of study to sit back and say if that tax was lower, your enforcement would be a whole lot less?
No, sir. We haven't.
Does it
I don't know
make
that I don't know if we were equipped for that necessarily to do that kind of a
Is
study.
that something we should consider?
So forgive me for this, but we kind of pride ourselves on not necessarily being policymakers, but carrying out the policy. And so I don't know how to weigh in on that. I don't know what the right answer would be. I do know that part of the increasing, I suspect and I believe that part of increasing tax rates isn't about generating revenues, but rather trying to stem consumption of the product. And so there are reports that we issue every year with some data that we get from the comptroller's office, this being one of them, because they sell those stamps to our wholesalers in Maryland. Those are the ones who apply them. They publish information every year about the volume of cigarettes or volume of stamps that are sold, which you expect that if the price goes up, the volume decreases. And I think that's happened at a variety of our points. I don't know about this most recent one, but at a variety of the times when we've increased the tobacco tax as a state, the volume of sales within the state have gone down. But I couldn't tell you that generated more importation illegally.
A licensed retailer right now selling cigarettes, if he's selling with stamps, what is the typical punishment for that?
The cost?
Stamps.
I'm sorry, what's the cost with stamps?
With false, phony
Oh,
stamps?
I don't know that they're any different than the cost that they would charge for anybody, which I think is somewhere around $15.
Pardon me, Delegate Aaron's, are you asking specifically what's the consequences, the criminal
Consequences, yeah. If I'm a licensed retailer.
I'm sorry.
Yeah, these are it depends on the offense, how much you have.
If I have one, if I'm selling an illegal pack of cigarettes, first of all, I have a process to buy these things legally. That falls on, that's me. If I go out and buy them deliberately, illegally, what is the consequence for that?
I mean, it's buying from other than a wholesaler,
fine.
which is it's a
So
misdemeanor.
I can pay my fine just like an underage drinking. I can pay that fine.
No, you get charged and you go to district court. There's potentially, you could face incarceration, and there's a fine. So it's very different. And then that's on the criminal side. On the civil side, you could go through an administrative hearing and potentially lose your license. So there are penalties on both sides of that.
If you were transporting them, it's a $150 per carton fine, mandatory fine, so you can't be reduced, or $300 for a second subsequent offense, and it's a felony.
I'm just talking about knowingly.
Your possession, you'd be charged with possessing, which I think is, I feel like it might be $300 in a year, I think, is what you could face for possession and for selling without, for buying from other than a wholesaler. I'm not certain, but it would be misdemeanor and probably $300 in a year as well.
Okay. My last thing on enforcement, cannabis, we've only been enforcing it for a little while. These were coveted licenses. These were very hard to get. They were great. We're going to do it. You're saying here you have about 8% of the people that sell it legally supposedly are getting charged with something? You said 99 cases out of 1,213?
Oh, no, that was the number of inspections that we conducted looking for. What we're getting at with that
Cases
is,
brought to court were 99 cases charged.
right.
If I,
Go ahead.
so, and I think Andrew gave an example. When we walk into any retail establishment, let's say it's Tom's Liquor Store, we go into Tom's Liquor Store, we're doing an inspection for cannabis as well as tobacco issues, as well as alcohol. We may not see THC, issues there, but we're still going to be doing an inspection because that's where we're seeing, some of those issues. So just because we have 1,200 inspections does not necessarily mean we're going to have 1,200 violations, because there are going to be a lot of, and we find predominantly, there are a lot of honest
Again, I was
brokers
dealing
there.
with the 99 cases charged.
Yes.
That's what I was dealing with.
And I'd say
that's
that-
only for half a year, so it's more like 16%.
It's,
Well, I think what you're saying is the percent of inspections done relative to that, but overwhelmingly, the number of inspections we do not reveal any THC being sold.
Okay.
So if we charge 99 people, I'll bet you the amount of cases we found out of that 1,200 were somewhere around 99. Because by and large, we're not charging somebody if we find a violation. So if they're selling it illegally, we're charging them, but we're finding that in our inspections, there's no violation more often than there is, meaning they're just simply not selling
I
it.
was misreading your numbers.
Yeah,
All right, thank you, Madam Chair.
Delegate Adams.
Chair, and thank you for the presentation. My question goes to the cannabis part, and I've been in the committee for 12 years, so I've seen the full arc of, we've had the medical marijuana, we've had decriminalization of the paraphernalia, and then decriminalization of marijuana, and now we've stood up a legal industry in the state of Maryland. So through this multiple years of conversation has been the concept that we're going to make it legal, and that's going to help get people in a place where they can consume cannabis without worrying about illegal purchases on the street, for example. And so when I see conversation about illicit purchases, I know that you're talking about through the lens of a retailer, but what, if any, interest or consideration do you and your department have as it relates to street drugs and the crime that relates to that? And do you think that having legalized this industry, are we moving in the right direction as it relates to getting drugs off the street so people can buy it legally, safely, so there's no fentanyl, for example? But I believe that I'm right in saying that, and by asking this question, 2 points. One, this was the whole rationale behind legalizing marijuana, was to get rid of the criminal component, but also to make it safer for consumption. And that two, once it stood up, that people would be able to access the product in a way that's legitimate, not illegitimate. So where do you see the state of this industry from that lens?
So that's going to be hard to answer, I think, because it's a big question. I do think, one, that there's product that's lawfully available that people can access. So I think that's happening. Regarding the street level dealing, I think part of the goal, I think, in legalizing cannabis was to provide a safe product that people could access. That was, one, you didn't have to worry about just the idea of being ripped off when you were buying it from somebody on the street, that you avoided that element of danger. You were going into a business, you were buying product that's been tested, has some analyses with it, is probably relatively certified that the quantity of THC in it is verified through lab testing, as opposed to buying it on the street. Whether or not it's decreasing that, we don't do the street level work. We do the work in this third leg of that stool, not the legitimate industry, not the street level element, criminal element, but rather that illicit market of businesses that also have decided to add this for sale to the list of the legal things that they sell. That's our area. We just simply don't have the authority to do the street level work. That remains with local police departments. I don't know how much we've impacted that. It's a great question. I see Andrew's chomping to answer this too. And I would just say that that's probably going to be something that comes out of like some of the uniform crime reporting information that comes out relative to that level of work. And I think it's got some other name now, but that's probably where it lives. Go ahead, Andrew.
Yeah, so Delegate, what you're asking about is what is sometimes referred to in a cannabis regulatory space as market capture, right? So prior to any sort of legal cannabis market existing, everyone knows that there was an illicit market for that, right? And the goal, to your point, of any regulated cannabis program is to increase market capture, right? More of the cannabis consumption coming through the licensed market rather than the other sources. You might recall in 22, you asked the House commissioned a demand study on total cannabis demand in the state of Maryland. And then you've additionally asked the Maryland Cannabis Administration to review that demand study every year. So I don't have their current findings for that, but that is something that you've charged the regulator with looking at. And in that report, in their findings, they should be able to start to answer that question of how much market capture do we have by doing surveys of cannabis consumption in the state, comparing that to what the total aggregate sales are. And assuming that, all cannabis demand is sort of a balloon, right? As the regulated side is growing, then we're shrinking the other sides as well.
Right, so I'm wanting to steer my concern accurately here because we spend a lot of time talking about North Carolina and illicit sales that find their way into Maryland for the purpose of doing this without the tax revenue. And so while we're talking about a different level of how the product is brought into the state of Maryland, in essence, we're talking about the same thing. We're talking about an illicit product being brought into the state of Maryland. And what's the concern with tobacco? Well, it's we're not getting tax revenue. So the concern is the same with the street level sale of drugs. It's happening free of the tax revenue, which at some point I would think would lead to enforcement just simply from the lens of, hey, look, we stood it up for the state of Maryland's general fund benefit. And at some point, don't we have a real concern beyond just the public safety aspect that if we're going to allow or continue to have people do this on the street, doesn't that defeat the purpose of why we spent, well, at least my 12 years in the legislature, decriminalizing and then standing up a legal industry? So, I mean, yeah.
Yeah, no, that makes a lot of sense. What you say makes an awful lot of sense. I don't know if we have enough data yet to be able to support that, or to give you an answer since they support it, but to give you any kind of an answer on that.
Right.
And I'm not sure where that would come from. The General Assembly was very careful to limit our enforcement ability, and I don't mean that in a bad way. What I mean is it was very specific. If it's a criminal act, then let the police department handle it. If it's an illicit act, if it's an act of a product that isn't quite lawful, but other functions are lawful, then that rests with us. But we clearly don't have the authority to impact street level operations. We do, it just doesn't simply live with us.
I understand. Well, my last thought on this would be if there is a marketing aspect to any of this that you're trying to get down to the citizen at the street level who's still buying it cheaply and on the street, is that, you're buying it with fear of dying because of fentanyl or frankly,
Yes.
Gang and drug activity that's purely illegal aside from just the sale of the drug, that the industry, the legal industry, the one that you're representing and defending and making correct from a regulatory standpoint, can and should be marketing on the street level in a way that, maybe I don't agree with this, but I'm just saying that at some point, isn't that where you and the industry have to lead, is getting people out of the street, crime and the drugs on the street and say, hey, there's another way. Marketing can't necessarily just be about, hey, let's do it at the tobacco shop and talk to consumers who are buying tobacco and say, look, there's another way to buy this. I'm saying get to the root problem here, which is why I think our industry stands up in the state of Maryland. That's my thought on it. I mean, you don't need to respond.
Yeah, please.
I'm just coming back
So
through.
I would just kindly ask the members if you could keep your questions concise, and if it's going to become a conversation, I'd encourage you to further the discussion after our hearings. Thank you. We'll go with Delegate Roberts and then Delegate Pippy.
Thank you, Madam Chair. My first question was actually going to be what Delegate Ahrens was talking about where the money, what happens to the money. So whatever information you're sending him, can you please send that to me as well? But I'm also concerned with what's actually happening in Prince George's County. You mentioned that since you've stood up the agency, you've been sued every year since the agency has been in place, right?
Well, what I've said is the state has been sued, not us specifically.
Okay.
The state has been sued every year by the major manufacturers who are part of that master settlement agreement going back to when it started, which was 2002 or 2003 or 2004. Somewhere around there is when it became effective. And so going back that far, the state has been sued by these manufacturers who want to do it every year because they're trying to recapture millions of dollars, themselves.
But so that issue or whatever they're suing for, what was the regulation that's in place? I mean, could you explain that?
It's not a regulation. It's an agreement between these major manufacturers of cigarettes and Maryland State to say, we'll sell, you allow us to sell into your state, and we will, because you say there's certain health illnesses, we'll give you some amount of money every year. But if you guys don't enforce that, if you don't stop other manufacturers from selling to the state who aren't part of this, and you don't create either an escrow account for them individually, which would be okay, but you just let anybody sell into your state and you don't enforce the inability of them to do that, then we're going to go to court with you and say you're not doing this properly, and let a 3-judge panel decide if you're properly enforcing your provisions or not. We have the laws in place to, and I'm saying I'm really almost speaking out of turn because, as I said, we are the foot soldiers who would do the inspections. But my understanding is the lawsuit is to determine whether or not the state, and largely through the Office of the Attorney General, has been diligent in how it enforces the provisions of the Master Settlement Agreement. And the first time we were sued, I think the judge panel determined that there was some lack of proper enforcement, and maybe there may have been a financial cost. But as I recall, I hope I'm correct in this, every time we've been sued since then, we've been found to be diligently enforcing the provisions.
Okay, good. That was my next question. I guess I was wondering, well, that was the question really. How many lawsuits have you won or lost? And are you being sued? I mean, I'm sorry, we, the state, are we being sued multiple times in a year, or is it just?
It's I think the first year it may have been like the first year, and we're so far beyond that now. Now they're starting to lump several years worth of effort. So they're not hitting us for every year. They're not doing another lawsuit every year. But I think most recently it could be a 3 or 4 year span that they're going to try and go at us next.
Okay, and then and then with respect to Prince George's County, I'm moving on to cannabis and how enforcement that's happening in our county, because I heard you mention, Baltimore City and other places. What is, because when I looked on here, I didn't even see, I heard that the most enforcement were coming out of Montgomery or the most cases were from Montgomery and Baltimore City, which I'm happy to hear that we weren't in the top 2, but are we the top 3? I mean, where are we?
We can actually, yeah, so we do have our dashboard. We try to make all of this public in terms of the information. So if you actually look at our dashboards, you'll see what we've seized from Prince George's County. And there's a caveat to that. Because of state law, we can't necessarily publish charges, specific district court charges against individuals and list those, because their folks have expungement rights. And if something is null pros, if something's dismissed, and we still have a charge up there, that taint of being charged in the criminal system follows that individual. And so we're prohibited from really publishing that information. So what we do is publish it kind of in aggregate and anonymized. But what we can do, and we can send this committee, is a list of the charges, a number of cases from each jurisdiction. So we can't name people or individuals, but just general aggregate information. Would that work for you, Delegate Roberts?
Yes, absolutely. Thank you. And then, I just wanted to know, was there an ask anywhere in here? Is there some help?
We're just letting you know what we're up to and trying to
Okay.
really provide you an opportunity to find out what we do and how that might help you in your work.
This has been very helpful to me, and I guess my last question was for Mr. Waters. Do you talk that fast like every day to everyone, or?
Yes.
Just when you're giving?
You can ask us that.
Yeah.
He does.
Okay.
He speaks quickly.
All right, thank you. Thank you, Madam Chair.
Thank you. Delegate Weibel.
Thank you, Madam Chair. So the illegal product, because I know our in-state growers are pretty heavily regulated. We've actually been through one of them, and it seems like it's, really run well and professionally. So the illegal THC levels, is that generally coming in from out of state somewhere, or is it both, or is it?
I would hazard a guess that it's probably coming from out of state, because there's an in-state legal mechanism for getting the product out. But I think a lot of it is coming from, I'll say out of state. We see some product that's labeled as made in California, because as in Maryland, the THC product has a Maryland, an MCA it's like the outline of the Maryland state. Other states have these same kind of logos or insignias that are required on their packaging. And we've seen many from California. I think Oregon told us that they're producing more than they can sell in Oregon, so they're probably selling a lot of it out of their state as well. And this is the trick. If they're producing it out of hemp, federal government doesn't care if they ship it across the country to us. If they're producing it out of marijuana, the federal government would have an issue with it because it's not legal at all. So you can't go across state lines.
Excuse my ignorance on this question. So are out-of-state growers allowed to ship to Maryland or only?
They're not.
Okay, I didn't think so.
Not under Maryland's laws, but the federal government would be silent if it was a hemp-based product.
Okay. And this question may be more for DLS, and I know you say that the cigarette tax is not about revenue, but it's about.
I don't make that, I'm just saying that that's.
I was kind of curious because when we've had a history of like passing what they called the millionaire's tax, and they actually collected less than what they did prior to passage of that. So do you guys have any records, or maybe DLS has the records of every time there's been a cigarette tax increase, what happens to revenue collections for that year?
Probably through the comptroller's office.
the
The comptroller would have it, because they're the ones who collect the tax, and they do that by selling the rolls of stamps.
Okay, all right, I'll check with
But,
them.
but I would just say that can be misleading too, I think, because what you might see is an increase in revenue, but if you divide that by the cost of the tax per stamp, an actual decrease in sales of individual units, revenue might go up because it costs more, but the amount sold might be
Yeah.
fewer.
Okay. And the last question on, I'm under the impression, I guess, that the feds reclassified cannabis to move it from the one schedule was on to another, or did that not happen?
I think there was an executive order to kind of dictate direction, maybe, right?
I can start,
Yeah, go
you
ahead.
finish? Well, the executive order that was signed strongly encouraged the Office of the Attorney General to complete the rescheduling of, from Schedule 1, which is where marijuana is now, to Schedule 3. But it has not been rescheduled. So, and then the second piece, because there are two pieces of this executive order, the second piece of the executive order was that the White House, I think, Office of Governmental Relations would work with the Congress to come up with a way to create a regulatory structure for low-dose hemp products. Currently, with the signing of the omnibus, I guess, operational bill back in November, on the federal side, there was language in there that made intoxicating THC products derived from hemp that were over 0.04 milligrams. 0.04 milligrams, if it was over 0.04 milligrams of THC, it made that product illegal within 365 days. So that was like early November. So there is a clock ticking on the legality of these hemp-derived products crossing state lines that started in November of 2025 and ends in November 2026. So if there is no law that's passed that creates some structure for a pathway for hemp products, then hemp will be illegal, be rescheduled back to Schedule 1, the intoxicating hemp. I'm not talking about the hemp for like hats or like insulation.
More so consumable hemp products, because the 0.04 is, the limit you all put in there is 0.5 milligrams, right? So 0.04 is a tenth of that. That is an incredibly low threshold for any consumable product to have THC in it. The only thing that really skates by under that is like a hulled hemp seed that you can use as like a protein powder or supplement, but anything that is otherwise commercially available, a lot of the stuff that we've been talking about, even like a CBD oil or tincture would not get past that 0.04 threshold.
So was the executive order, was that only dealing with hemp, or was that dealing with?
It came after the congressional work on the hemp products legislation. So the first part of it was specifically to cannabis and rescheduling and continuing those efforts that previously occurred. But then the second part seemingly was in response to the congressional directive to FDA to set really strict standards on THC products.
So if they reclassify the schedules, can that be done by FDA, or is that done, does that require the congressional action?
It's a multi-step process so FDA started what they call their 4-factor analysis on the drug safety, and then they make a recommendation to DOJ and the Attorney General on where that falls in classification. And there's the regulatory process there. I don't believe that it would then need to get ratified through congressional action once DEA and DOJ sign off on the rescheduling. But again, that's going to take a while for those gears to turn.
So what I'm leading to then, if the feds do that, what impact, if any, does that have on then Maryland's program?
Sure. So the biggest thing that a lot of folks agree on that would impact a regulated cannabis market would be some tax benefits, in particular for those businesses that are operating. Right now, the effective tax rate on regulated cannabis businesses is higher than your standard businesses because of a provision in the tax code called 280E, which essentially means you can't deduct from your business expenses illegal activity, including stuff that's on the federal schedule. So once that gets descheduled, that drops off for a lot of those businesses, and their opportunity to become profitable helps them out quite a bit. I think there's going to be a bit more of an open conversation about how much of state level markets get preserved, what amount of state level preemption the feds want to allow if we are in a Schedule III environment. Another piece that would be considered is for other drugs on the schedule, right? In order for them to be produced and manufactured, they have to be produced in facilities that have certain cleanliness standards, right? And other regulatory provisions around like how you make Tylenol and stuff like that, right? That's not something that can be easily mapped onto a cannabis grower facility. So there's still a lot of questions there, but the one.
So you think all of our other systems that are in place would stay the same if it goes to Schedule III? I'm talking about the ability to sell it at the retailer and the distributors, the growers, or does that all change?
I mean, I think it's going to really depend on how much additional action the federal government takes beyond rescheduling. What does that mean for interstate commerce? What does that mean for the ability for the state to regulate this product as well? Where does it fall in how much authority that we're granted in that process? It will likely pretty substantively change, or at least change how we have to consider the product when we get there.
Okay. All right. Thanks.
Thank you. Delegate Bandari.
Thank you, Madam Chair. Thank you, directors. And since the law, I'm on for your reference, page 4 from the back of your presentation. Since the law took effect, ATCC conducted over 1,200 inspection and brought 99 cases to court. Enforcement I'm wondering if it is concentrated in a small number of jurisdictions like Baltimore City, Montgomery County, and Baltimore County. How is this ATCC ensuring consistent and equitable enforcement statewide rather than enforcement driven by complaint or capacity differences?
Good question. Thank you very much. First, we'll just say that if you look at this, it does show that we've been all over this.
Hang on one second. Your mic.
The mic's went out.
Yeah. Oh, there we go. Okay, it's a great question, and thank you for that. This one chart just shows where we've been. So you can see we've been from Western Maryland to the Atlantic Ocean, and most points north and south. We've been in most jurisdictions conducting the enforcement. I think the way we try to be as fair, there's certainly going to be more density in the number of businesses in more of the urban areas, but to make sure we're giving everybody equal treatment, all of our agents, all of them, can inspect for all of these products. We don't have just a crew that does the cannabis work, and so they go to an area and they spend all their days in one spot. I have agents who are assigned, of those 30 agents, we're all assigned to our headquarters in Baltimore, Most of them rarely come to our headquarters in Baltimore. Western Maryland crew stays, they live out in Western Maryland, they work out in Western Maryland, Southern Maryland, Northern Maryland, so that's kind of how it is. For the most part, our agents live in the areas that they work in, and they're trained to do alcohol, tobacco, and cannabis inspections in all of those areas, and they do. When they find the violations, it's just that there are fewer of them in the more rural areas. But I don't know if that completely answers your question, but it's just that everybody has the ability to do all of these inspections, and they all have some level of these inspections are doing.
Given that unlicensed THC sales and THC above the legal limits remain the most common violation based on your presentation, do you have any evidence that enforcement actions are actually reducing repeat violation, and what preventive strategy are you using to stop illegal sales before enforcement becomes necessary? I'm talking of the education piece.
Great. So I mentioned to you that starting July 1 or July 2 of 2023, we went out with brochures, and the brochures have had a lot of data about the cannabis law, and they also had those QR code boxes that we would people could access, which would take them back to our site and have tons of information about the law, and would also take them to the Cannabis Administration's website, again, understanding how to do it lawfully. So we went out and we distributed those for months. Then when we were sued and there was a court injunction put on, we gave them essentially the same document, the same bulletin or the same brochure with the same information with the addendum now that temporarily, if you were in business, for the time being, if you were in business prior to July 1, you may continue, but pay attention. Because if the law changes, you're going to be in violation of the law again, and we will be back to conduct this enforcement. When the injunction was removed, we started to educate our staff. I would just say that the Alcohol, Tobacco, Cannabis Commission has a long history of attempting to educate. We want people to be in compliance. We have no interest in putting people out of business. We want them to be successful in business, and we want to help them be successful if we can. At the same time, we're going to hold them accountable to what the law is. But we don't choose strict enforcement on a new law as our option. We rather choose significant levels of education first. When House Bill 12 was passed and signed into law in April, but it wasn't going to become law until July 1, we started in April going out and educating these people so there would be no surprises, so they would know. And to demonstrate some of the effectiveness of that, we went to one of our wholesalers that we knew was selling this product. We'd seen it before this law, House Bill 12 was law. And we told them, look, you got this stuff now, guys. You're not going to be able to sell this when this law passed. We're just letting you know that. It's going to be illegal. We went back there shortly after July 1st. When the law was effective, it was empty. And we went and said, hey, you got rid of all your stuff. And they had a lot of stuff. They said, we heard you. We understood. You told us what was going to happen. And so we think we're effective in that as well. We don't know where all the businesses are that are selling this because they don't have a license because they can't, because it's just illegal. But whenever we go into a place that would be likely, the kind of business likely to sell it, like a tobacco retailer, we give them information. We don't want to have to enforce it that way. We want compliance. That's what we want.
Thank you.
If I could just, Delegate, if you check out our website, all of the materials that the Executive Director talked about, they're all on our website. So we push this out through our eGov delivery system. We do the outreach to the local health departments. We reach out to the associations to let their members know about what's going on. And we actually participate in a lot of association meetings, providing information. I think just recently you were at the gas station. I can't recall.
Yeah, it's a service station, Maryland Car. I don't know the acronym, but they're all the gas stations that have convenience stores. And I go to them every year and let them know what's happening.
So it's a proactive effort to answer your question in terms of the education outreach.
Thank you. And it looks like our last question. Bring us home, Delegate Queen.
Okay, mine is be very quick. I just want some clarification. So, Director Kelly, when you were first talking, I think this follows up on Delegate Sheed's question, and you mentioned some concerns related to alcohol regarding the stamps and the excise taxes and the challenges or threats from Virginia, North Carolina, and Pennsylvania. I think what we're trying to get across, I know you don't set policy, but we really need to know if there's laws in place that are restricting your ability to do enforcement or limiting you in any way from carrying out the intent of the policy. So I think that's what we're trying to ask. Is there something we need to change or look at related to the stamps or the excise taxes? And if you have some suggestion about better models from other states, that would be helpful.
No, thank you for that, and that's a great question. No, I don't think we need anything new. My purpose in mentioning that was that it's a shift in the type of criminal activity we see. When I first started with the comptroller's office back in 2002, we used to go to Virginia 6 days a week. We didn't often go down on Sundays unless we had specific information, but we went down 6 days a week. Oh, yeah, right, yes, that's right, thank you. And when we would go down to Virginia, we would go to a place that we knew catered to smugglers. For cigarettes, in this case, just cigarettes. They would cater to smugglers. When I say catered, you walk into the store and you will see black trash bags with cube-type items in these trash bags, which were actually cases of cigarettes packed up, maybe with a name on it, because somebody was coming from New York, largely, coming there to buy these cigarettes at a cheap price and then head back. But they'd place their order and they would cater to them. And what I see now in a shift, that still is continuing. But we're seeing now, but we never saw, what we'd see, these cigarettes would come into Maryland, they'd end up in stores, they didn't have a Virginia stamp on them. They didn't have a Maryland stamp on them. They had a Virginia stamp. But now, because our tax rate is higher, it's worthwhile of going through the extra risk and expense, perhaps, of printing up counterfeit stamps and putting them on there so that it's easier for them to pass. But I think through the security features that the comptroller has required for these cigarette stamps and the laws that currently exist, by and large, help us and have always continued to help us and still help us in our work on that. So it's really more of giving you an update on some of the trends and how it's happening. Having said that, as my dear friend Andrew just reminded me, that House Bill 1000 from a couple of years ago, I think would have done a lot for us. And again, this committee passed it and this body passed it, the House passed it. But it would have allowed us to go into those back rooms of these retailers that we think are selling some, that maybe you're selling some nefarious products, doesn't really matter. It just would have allowed us to walk into the back room and inspect the product. And we just didn't get that. And I don't know that we'll ever have it, but that would have been something that would be helpful. I don't know if there's an appetite to try that now. That's not something we're requesting or promoting right now.
Okay. Well, thank you all. Thank you for your presentation and your answers to the questions. And I suspect that you're available if people have any follow-up questions by email.
Yeah, always.
And members, we don't have any events tonight. Tomorrow, we're supposed to have another briefing, but keep an ear out in case things change if floor goes long. And have a good night.
Thank you.
Thank you.